Welcome to Family Health, a holistic healthcare show that aims to educate you, inform you, and uplift you on all matters health. My name is Wajira, and I'll be your host for today. God gave us amazing bodies, but once in a while, we all get ill. And we're here to take you on that journey right here at Family Health. Now, skincare, beauty, acne. We are always looking in the mirror trying to see, do I have dark skin? Do I have hyperpigmentation? Is there some discoloration? Men are even conscious about razor bumps when they get a shave. We want to get a solution to all these problems today. And we'll be speaking to quite a few people today. We'll speak to a dermatologist, an esthetician, and her patients as well. We want to find a solution that you may resonate with regards to all these conditions. Globally, acne is very common and it starts right from teenage years. Therefore, we need a solution. Look, it's going to be an interesting show. Do not go anywhere and join me on this journey as we explore all these skincare issues.
My name is Jacqueline Mutua. I'm a clinician specialized in dermatology. I'm very passionate about the African skin. When we talk about dermatology, it's more of, I treat both children and adults. Yes, basically that's my day is just about dermatology, Monday to Saturday.
My name is Mike Mother. My acne started when I was young, when I was a teenager. Those days, I didn't know much about beauty or anything, so you keep on trying anything that comes your way, and instead it worsened my situation, because me, I'm from the village those days, so you can imagine you're just trying things that you feel or someone is recommending and they're not professional. And I guess that's why my acne, I got the pitted acne. Some people might think most men don't value their skin, their facial skin, but for me, it really affected my self-esteem, especially when people would look at me or ask me what's happening to your skin. It's really affected my self-esteem.
Men have poor health-seeking behaviors. Very few men come to hospital, even when it comes to their dermatology conditions. Having papules on your underarms can be really something that you feel is private, so most people wouldn't come to hospital.
Acne is a common skin condition which affects both men and women. It can cause those affected to have a distorted view of themselves.
Acne is an inflammatory skin condition where I would explain it to make it simpler, where the normal things that people call pimples, or it's an inflammation of the skin that comes as a result of plugging of your pores, or what in common terms we call blocking your pores. What happens for you to get blocked pores is because your skin tends to overproduce oil on certain areas of your skin, especially the face, the chest, the upper back, the shoulders. Yeah, so it's an inflammatory condition that affects the oily areas. There's no particular food that causes acne, but having a lot of high glycemic foods, for instance, lots of sugar, lots of the cookies, the things that we love that have sugar, for people who love sugar, yes, they tend to affect our hormones in a way. And one of the, like I said, acne is, the inflammation is triggered by many things. Having high glycemic foods can in a way affect our hormones in a way that can end up giving an inflammatory condition on our skin.
My skin is very oily, and so I'm too much prone to breakout. Like right now I have some, especially when I have a shave. When I shave my beard, I get the breakout and then the ingrown hair. Plus now, because of the acne, I've had some pitted acne scars. I came across a Skin Sol aesthetic clinic. When I came, we did a few of the treatments, which already we are in the progress of doing it. I already have seen some improvements. To start with, of course, I came, did skin analysis. They recommended some few facial treatments, or I was given a treatment plan, and we started with the most basic, then we followed with some more deeper treatments, those have really helped me.
Actually, acne is treated as per grade. We grade them as grade 1, 2, and 3. Grade 1 is just the mild kind of acne, where we have just the whitehead and the blackheads. Grade 2 is now where we have some pustules. Pustules are, I would call them pus-filled pustules on your skin. And for some people in grade 2 might have some pustules and nodules. And then grade 3 is now where we have severe acne. Severe acne, now we have the nodular cystic, the nodules, the cyst, the papules, everything together. And it's very severe and gives the patient even pain. Treatment is different as per grade.
My pitted acne scars, they were so deep when we started, and it's been like 4 months now. And right now, it's like they are no longer there. Okay, I'm not yet there because we haven't completed the treatments. I have some more sessions to do, but so far I'm happy.
We will watch and listen to aesthetician Chacha as she takes Mike through a skin treatment.
Hi.
Hi.
My name is Chacha. Today I'd like to be your therapist. First I'll use a magnifier to check your skin. How have you been? Plus to get some more details. So this is a magnifying lens. So I'll have to pick some details that we didn't pick from the skin analysis. Around your eyes, I can see you have some small skin tag. You have pitted acne, which you had said about it. On the cheeks, I can see you have the laser bumps. What happened?
I shaved some days ago.
How many days ago?
Like 2, 3 days. Two days. Yeah.
Oh, okay. I can notice you have some inflammation. Yeah, plus you have some new breakouts.
Yeah, that's because of the shaving that I did.
Okay. That is. That's why now today I recommended like you do the quick peel so that you can reduce the inflammation and the acne.
Next, we watch Chacha as she starts a series of treatments on Mike's face.
I'm preparing your face before I cleanse. Okay, I'm going to cleanse. This is a paramedical cleanser. Yeah. I'm going to double cleanse. The reason why I'm double cleansing is to ensure like your skin is clean before we do now the quick peel.
Double cleansing is a skincare method where you cleanse your face using 2 different cleansers or the same cleanser twice.
I'm steaming your face so that I can open up your pores by the wax and dead tissue that are in, so that when I'm doing the extraction, they can easily come out. We are going to do the quick peel. So it has a pseudo heat. So you may feel like it's burning, but at least I have a fan here. So I'd like you to help me. So I'll be starting where you have like your thick face. So if you feel like a bit tingling, just here it's the pseudo heat. Yeah. The function of quick peel is to reduce inflammation, kill bacteria, and reduce the sebum secretion. This is going to help you when it comes to inflammation. Yeah. Now we are going to do the enzyme 1 mask. The mask is going to stay for 45 minutes before I remove. I'm applying towards the using a certain direction, because the mask is going to crack, so, and it's going to squeeze your muscle. So I have to follow how your muscle are. Yeah. You are going to stay like this, don't move, so that you don't feel that tightness. Yes. I'll be coming to see you after 45 minutes.
As Mike's peel is drying, let us speak to the dermatologist to get a better understanding of razor bumps.
Razor bumps are as a result of poor shaving techniques, majorly affecting the hairy areas, the underarms, the private area. And it's a very common condition we see in our clinics every day because of the poor shaving techniques that we have adopted as a population. One of the treatments that we give are topical antibiotics that you apply, but the best of the best is to prevent other than treating when it happens. And adopting good shaving techniques that do not irritate the skin, because the available methods of removing hair, the razors, the hair removal creams, most patients react to the hair removal creams, and that irritates the skin and it ends up inflamed. When it comes to using the razors, it cuts very close to the skin, irritating the hair follicles, which end up being inflamed. Other people have adopted use of laser. Laser is very safe and destroys the hair follicles, which most people who use laser do not end up with the inflammation on the areas they have removed hair. Other methods that people tend to use, which I recommend and I find it very safe for patients, is using the normal scissors. But it might not give you the cosmetic outcome that you want, but it is the safest.
Let us go back to Mike and see how far along he is with his treatment.
So how are you feeling, Mike? So you can't talk? Okay, that is the effect of the enzyme 1. That's how it works. By squeezing it, now it's giving your skin the true oxygenation and supply, and it's removing all the dead tissue that you had. Okay. It's time to remove your mask. I can see it has cracked well.
I feel like my skin is breathing.
Okay. This is the last now process. I'll be cleansing. After this, I'll use ice cube. Then after ice cube, I'll be doing something we call rebuilding by putting some products. Then from there, we'll be done.
Mike's treatment is done, and the eye station applies sunscreen to protect his skin from the rays of the sun. His results can be seen in the mirror, quite literally.
I could literally see a difference in Mike's face. I mean, before the procedure, his face looked a bit dull, it was very oily, but somehow after all those treatments he had, to me, his face was just glowing and it looked smoother. I mean, if you're at home and you have a skincare condition, I hope you now know that there are so many solutions, as the dermatologist has told us and as you've seen for yourself. Now, skin texture can actually affect self-esteem. It can cause high self-esteem or it can cause low self-esteem. And I'm curious to know, you at home, if you have any skincare condition, how has it affected your self-esteem? Please let us know via SMS on 20316 or WhatsApp on 0786 316 316. See you after the short break.
Get all the latest Christian news, current affairs, opinion articles, entertainment updates, movie reviews, podcasts, and much more with a quick scan of the FamilyNews.today QR code. Experience insights at your fingertip on any device on the go. All you need to do is scan the code.
Welcome back to Family Health. If you're just joining us, today we are discussing skincare, particularly acne, razor bumps, and also hyperpigmentation, which just means discoloration of the skin. Now, we looked at Mike before and we saw that he had acne and he had razor bumps as well, and we had a chance to see the treatments he got, and we also had the dermatologist's input into some of the solutions to this. Now, next we are going to speak to Esther, a young lady who has also had a severe case of hyperpigmentation, and she's going to be telling us her story.
When I was in high school, I can remember a few incidents here and there. My skin, it will be like I have 3 different types of shades. Yeah, from my forehead, you can see it on my cheeks and up my lips. Here I'll be too light, here I'll be dark, here it will be like it's a mixture of things going around my face. To me, it lowered my self-esteem because everyone around me saw it and was like, what's wrong with your face? Mbona uso yako iko hivi, unakaa, are you bleaching? And some people thought I was bleaching my face, and it will just lower my self-esteem.
How do various skincare issues affect individuals psychologically?
Psychologically, most patients with skin conditions have low self-esteem. They are stressed. They feel they are not socially accepted. And for that reason, most of the time we need to work with mental health specialists. For instance, acne, the pimples, the dark spots, the pain. And one thing I would say is your skin represents you. How you look, before you even say a word to me, most of the time I judge you. It's just human.
Now, what exactly is hyperpigmentation and what is its leading cause?
Hyperpigmentation happens when your skin produces a lot of melanin, and there are so many things that trigger overproduction of melanin on your skin. And one of the things, the commonest, is the sun, UV rays from the environment. When you use bleaching creams like hydroquinone, there are many creams that are mixed, and steroids being part of them. They make your skin very thin, and once your skin is very thin, UV rays go very deep in your skin, destroy your skin, triggering your skin to produce a lot of melanin to try and protect it, because melanin is protective. So in the process, you end up getting the hyperpigmentation. Other causes of hyperpigmentation could be the hormonal part, the melasma, which now happens when people are going through hormonal treatments or just hormonal fluctuation in women, especially during pregnancy and lactation. One of the most difficult things to treat in dermatology is melasma, which is a type of hyperpigmentation.
My hyperpigmentation, I was told it was being caused by the UV lights. Like you see where I went to school in high school, it's in the western parts, the Busia uko kwa border. So the sun was too hot and I never had a sunscreen or anything. So it really damaged my skin. My skin barrier became so weak. I will seek, yes, medical attention, but most of the time it will be like I'll be given, what are they called, the creams. The creams, I'll apply it on my face, then it will, the problem will go away for like 2 weeks. Then after 2 weeks, it will then reoccur back.
Now, let us watch as Esther gets her skin treatment.
Okay, I'll start by preparing your skin before we do the cleansing. So I'm cleansing. But your skin has improved. It's not like the last time you came. So now we are going for the hydra. By hydra means water. So definitely what I'll be using. At first I'll clean with water, and because of hyperpigmentation, we'll be now using the glycolic as the treatment. Okay. Yes.
Esther gets her face cleansed a second time, which is followed by a moisturizing cream and sunscreen. Esther's treatment is done and will leave her skin looking fresh and revitalized within a few days. Skin bleaching is a controversial practice in Kenya, often driven by cultural perceptions. How is it treated?
The most important thing that we do is to ensure that you withdraw the bleaching. 2 is to ensure that your skin is now not as sensitive as it was. So we start with some creams just to heal, and sunscreen every 4 or 5 hours in a day, so that you sun protect, heal your skin. Once your skin heals, now we have safe methods where we use chemical peels. There's no single method of treating hyperpigmentation that can clear hyperpigmentation within a week. It's a lot of patience and work. We need to ensure that once your skin has healed from the hypersensitivity from the bleaching creams, now is when we plan treatment for you, which most of the time it's a combination of things, sunscreen being one of them. Using the healing cream still continue as part of your treatment. There are other methods of where we use PRP, which is, and GFC, which also minimizes. We use your own blood to treat your skin. It's a combination of things. There's no particular method that can clear hyperpigmentation. Sunscreen is very important. Should be used every day of your life as long as you're exposed to the UV rays. Nowadays we even have sunscreen for as low as 6 months old babies. Every time we wake up to the natural light, we are exposed to the UV rays, so there's need to protect our skin from UV rays. Sunscreen helps with reducing the UV rays penetrating your skin, and that way you minimize chances of having UV related skin conditions. 2, it also minimizes chances of, actually averts aging. No one can stop aging. Aging is a natural process. It also minimizes chances of having hyperpigmentation, because the major causes of hyperpigmentation in our population is UV rays.
Keloid scarring is more prevalent in individuals with darker skin tones. What causes it?
Keloid scarring comes as a result of excess healing tissue on areas that have had trauma, and trauma could come as a result of skin conditions like acne, cuts. If you sustain a cut from maybe an accident, you can get excess healing tissue. Most patients are able to tell you that I have a keloid here, I have a keloid there, because they tend to run in families. And also the other thing is the excess healing, where they're having the excess healing tissue, it starts as an itchy lesion. It doesn't heal. Once the wound closes, the skin now starts to grow and it becomes very itchy. And that way you will see the need to seek medical advice because of the abnormal healing tissue.
What new advancements do we have in skincare?
There's a lot of advancement when it comes to diagnosis in skin diseases. We have very good technology in terms of once we take our biopsies, and the dermatopathologists are able to give us very good diagnosis. We're able to do telemedicine. We're able to consult at the comfort of our homes. Everyone is aware of AI. There are softwares that are coming up that can help us diagnose skin diseases very early. So there's a lot in terms of new trends when it comes to skin diseases and treatments.
Now, let us find out what Dr. Jackie does to unwind and relax after a busy day at work.
Oh no, I can't sing. Mtuapa, yes. I cook. I love cooking. Do I have one, really? Kambua. Of course, Spider-Man, because my children love Spider-Man. They want to act like Spider-Man all the time.
And there we have it. What a delightful episode to watch. To be honest, I also suffered from acne as a teenager, and I did undergo a series of treatments. So I can really relate to people who have had issues of acne and, hyperpigmentation. There's a way it just affects you and can also make you lose confidence. So how good is it to know that nowadays there are so many solutions? If you're out there and you're watching this, and maybe you, especially if you're a man, men don't like looking for help to do with their face. They feel like they're going to be seen as vain. You don't have to feel that way. You can literally go to a dermatologist and you're going to get all the help that you need. My take home for today actually was sunscreen, sunscreen, sunscreen. It's really hot right here in Kenya and we really need to protect our skins. What was your take home? I would love to know. And that's it. That's the show for today. Always pray for your skin. I mean, why not? It seems like perhaps vain thing to do, but pray for your skin because it actually affects how you feel. I look forward to seeing you on our next episode on Family Health. Do have a lovely week again and see you next time.